Democrats and the Republican Club. I would like to thank our debaters for joining us today and helping us to inform our student population as well as our community about views on healthcare. My name is James Lyons. I'm from the Political Science Society, and I will be moderating this afternoon's debate. It is our hope that our participants will help inform you about the various topics surrounding the national healthcare debate. You will be able to see this afternoon the various views held by each political party. Before we begin, though, I would like to take this opportunity to introduce those who will be debating this afternoon. For the Siena Democrats, we have John Daly, Mike Elliman, and Ben Thomas. For the Siena Republican Club, we have Ed Bigini, Brian Dorian, and Francis Stanley. During this debate, 6 questions will be asked in total. There will be time for a 3-minute response and a 2-minute rebuttal. Our questions encompass some of the various hot-button issues that surround the national healthcare debate. After all the questions have been asked, each side will then have the opportunity for one of their members to provide a closing argument, which is limited to 3 minutes. All of our participants are aware of the questions and their time constraints. However, they are not aware of the order in which the questions will be asked. We did flip a coin before to determine which side would go first, and it was determined that the Republican side would have the first question. I'd like to take this opportunity now to remind each side that only one person may answer each question, and only one person may provide a rebuttal. Thusly, each person can then have the opportunity to provide one answer as well as one rebuttal. Okay, so we're going to begin with the Republican side. And let us begin with a financial question that is on a lot of minds. How is the Republican Party working to make health care affordable? That is, how will the costs of your party's plan affect the average American citizen?
All right. Well, the main goal of the Republican plan is the Patient's Choice Act. And one of the couple of the issues that they hope to get through on that is the offer the rebates of purchasing health insurance of $2,300 for individuals and $5,700 for families. Basically, fixing the tax code as it is right now in order to encourage individual people to purchase their own health care outside of the business instead of punishing them and having the system that's created towards the rich. Another issue that they want to attack is the allowing consumers to purchase insurance across state lines. The CBO estimates this will reduce our deficit in 10 years by $7.4 billion. And crossing state lines will offer not only just one different form of competition, but 50 forms of competition. And with more competition, the more prices go down. And along with this, it also allow people to bypass certain regulations and mandates required in their own state and get to less regulations and basically more attuned to what they want to see for basic care. Another issue is the tort reform, basically in protecting doctors from fearing medical malpractice lawsuits. The CBO estimates that this will save $200 billion annually. In 5 years, this will save us what the HR 3200 will cost. Another aspect of this too is also that the health insurance. One of the things that's causing it to be so expensive nowadays is the fact that doctors have to pay their own form of legal insurance. And with malpractice suits being what they are today, they're paying just as much as we are for our own basic individual health insurance. So the cost has to go somewhere. So hopefully with tort reform, we'll be able to alleviate some of those pressures.
Thank you, Francis. Democrats, how would you respond to what was just mentioned by Francis?
Well, I respond by saying that the plan proposed by Senator Wyden from Oregon does basically the same thing. It will remove certain tax credits for employer benefits, and what that would do is it would in turn give it to the average individual to make it cheaper for them to afford their own health care, so they wouldn't have to do it through their employer. Of course, we've talked about the President's plan, which has discussed creating a public option. And the hope would be that a public option would give employers, should we keep employer insurance, something to buy into, something to reduce their overall health care costs, increase competitiveness, and give the average person more choice when looking for a health care plan to cover them and their family.
Thank you, John. Our next question will be answered again this time by the Democrat side. Let's look at the effects of healthcare reform on the owners of small businesses and their employees. I know many of us are employed by small businesses. Democrats, in your party's view, how would the president's healthcare plan affect small business owners and their employees?
Well, as I said, the president's plan, the possibility of the public option would affect small business more than anything else. It would make it much more affordable for them to buy into a healthcare system rather than having to pay a lot of money out of pocket to cover their employees. And the belief would be that that would reduce costs in the long run. It would improve competitiveness in the small business field. Right now, the way the system works, generally your small business owner will buy healthcare insurance for their employees with the hope of increasing competitiveness with, say, the shop down the street. Well, by reducing the cost of that, the ability to compete rises, and the ability to cover more employees for less cost ends up working out. So,
thank you, John. Republican side, what is your rebuttal to that?
What you failed to mention is that the president's plan is also going to penalize those small businesses that choose to not offer insurance to their employees. And what's going to happen, what the CBO, the Congressional Budget Office, says is going to happen, is that that cost of that penalty is going to fall directly onto the employees. This penalty is basically going to be an increased tax on the business. What's going to happen is, in order to make up the profit that's going to be lost from that tax, employees' salaries are going to go lower. They're also not going to have health insurance either. So we can either have a system that allows businesses to move away from giving health insurance and stick, like what the Patients' Choice Act says, is to tie health insurance to the individual rather than the business. And if you may want to rebuttal, minimum wage workers may be affected even more so. If there is a business that employs minimum wage workers and chooses not to offer health insurance to their employees, they're going to have to pay that penalty, like I said before, except the penalty, instead of being lower wages, they're going to be fired and laid off, and they'll still be without health insurance. So the president's plan is completely ridiculous. If you want lower wages, and if you want to see employees lose their jobs, then you would go with the president's plan.
We're going to now allow the Republicans to answer our third question, which looks at the effects on healthcare reform and the elderly. Republicans, in your party's view, how would healthcare reform affect our senior citizens?
We are of the opinion that H.R. 3200 and the Baucus bill both claim they will squeeze savings out of Medicare, which means that instead of allocating money to put in a new, for the reform, they're going to take money out of an already struggling government entity, which I believe is $32 billion in debt already. And they're going to try and ration the care with procedures and the medicines for senior citizens. There won't be enough money under this plan, H.R. 3200 and the Baucus bill, to squeeze savings out of Medicare and then provide the type of care that our seniors deserve in this country. Obama said that he can get $500 billion in savings from Medicare, yet only $60 billion, to my knowledge, would be attainable due to fraud and other corruption that happens with large bureaucratic things such as Medicare and other government programs.
Thank you, Brian. And now for the Democratic rebuttal.